Hi guys, welcome back. Today in this lecture video, we'll be talking about anxiolytics and sedatives, medications, okay, anxiolytics and as well as sedatives, and the the most important mechanism that is used in the anxiolytics and sedatives usually will be involving this GABA receptor. So if I'm going to continue to talking about GABA receptor through this video, you should know how does this GABA receptor looks like. I mean, at least you should know how roughly it looks like. So that's why I've added a new additional slide, which I've drawn as I've shown in this video right now in this slide, and I'm just going to explain roughly about how GABA receptor works before we move on to anxiolytics as well as sedatives. So okay, let's get started about GABA receptor first. Okay, as for the GABA receptor, basically we have two types of GABA receptor. That is the first one is GABA receptor A, and the second one is GABA receptor B. The GABA receptor A is ionotropic, and GABA receptor B is metabotropic, which means a metabotropic means it is going to be a G protein coupled receptor. But in this lecture video, we are just going to learn about GABA A receptor. Okay. So as for the GABA A receptor, as I've drawn in this video, okay. So we are going to learn about the structure of this GABA A receptor from the front view as well as the top view. As you can see here, as you can see here, this is actually the front view of the GABA A receptor, and this one is actually the top view of the GABA A receptor. So the GABA A receptor, we have two betas, two alphas, as well as one gamma subunit. So basically it is a pentameric unit. So which means it consists of pentagon. Pentagon means 5. So penta means always 5. So that's why we call it as pentameric structure. So it means like it consists of 5 subunits which are arranged intracellularly and extracellularly. Okay. So you can't really find out where is the binding site from the front view. So we are going to talk about the top view. Okay, this is actually the top view. So from the top view, we can actually see that the GABA receptor, they are main. Okay, basically, okay, from the top view, we can actually find that there is a central chloride pore. Okay, this is the central chloride pore, and two binding site. This is the two binding site, GABA binding site as well as the benzodiazepine binding site, BZD binding site. So mainly there are 3 binding sites, but for this illustration purpose, we just only draw these 2 only. Okay. So as for the GABA receptor, GABA binding site, it is always between alpha and beta subunit, and benzodiazepine binding site, it is actually it is always between alpha and gamma. Okay, alpha and gamma subunit. There's another that is actually between beta and gamma. There's another between beta and gamma. That one we are not going to learn right now in this lecture video. Okay, so the mechanism of how it works is basically the basic step involved in the activation of GABA receptor is binding of ligand or drug to the GABA site or the BZD binding site. Okay, now due to this binding, the central chloride pore, this chloride pore will actually opens up and causes the influx of Cl- ion. So your Cl- ion will actually enter, and this eventually causes the inhibition of neuron by creating a state of hyperpolarization. You always know that when Cl- enter or K plus enter, it is going to cause a state of hyperpolarization. Okay, so when there is a state of hyperpolarization, eventually causes inhibition of neuron, and that neuron is not going to generate any action potential. Okay, so now we will be moving on. Okay, now we have studied about the GABA receptor, and let's move on to what are the drugs that actually act on the GABA receptor. Okay, first of all, the drug that actually can act on the GABA receptor is the GABA itself. It is an endogenous agonist of the GABA receptor. It is an endogenous agonist of this GABA receptor, and it is really released at the various sites of the central nervous system. and it always acts on the GABA side, causes the so this GABA drug itself will actually bind onto this GABA binding site, eventually causes Cl minus to actually influx and cause key neuron to not generate any electrical activity. The second drug that actually can act on GABA receptor is the positive allosteric modulators, which eventually bind to the BZD binding site and cause influx of Cl minus ion anion. So, what are the examples of these positive allosteric modulators? Benzodiazepine itself, BZD, barbiturates, muscle relaxants such as thio. Okay, you don't have to remember what is the name of the medication. It is basically called thiocolchicoside, but it's okay, you don't have to remember that. The fourth one is anesthetics, such as propofol and etomidate, and the fifth one is alcohol. Okay, those are the things that actually bind to the BZD. The one that actually binds to the GABA is GABA itself. And then that is the positive allosteric modulators. The third one is also known as the negative allosteric modulators. Okay, for example, flumazenil. So instead of enabling the drugs to bind onto the BZD binding site, it will actually block the drug from binding to the BZD by the binding site. So this flumazenil, it actually blocks this BZD binding site, and this flumazenil. Okay, let me just write the flumazenil. Okay, this flumazenil is basically given in benzodiazepine also overdose as well as a reversal of anesthesia. Okay, so all the what are the you need to know what are the effects of the activation of GABA receptor in order to understand this whole lecture about the anxiolytics as well as sedatives. Okay, so the effects of the activation of GABA receptor is of course mainly as what it's usually it is in pair with the drugs that is acting as the positive allosteric modulators. Okay, for example, it is used in the it can actually cause the effect of anxiolysis, anticonvulsant effect, sedative effect, partial amnesia, as well as muscle relaxation. Okay, so those are the effects of the activation of the GABA receptor. Now we're going to talk about we're going to get into the details of this anxiolytics as well as sedatives. So first of all, we're going to study about the general function of the anxiolytics. So the general function of the anxiolytic is increase GABA effects. Okay, that means like releasing GABA. Okay, the first one is always increase GABA effects. The second one is releasing GABA. Okay, releasing when they actually release GABA often, it will eventually makes a person feel more relaxed and sedated. So physiologically, muscle relaxes and breathing slows down. So this is actually the effects of the anxiolytics. Muscle will eventually gets relaxed, breathing slows down, you feel more relaxed and you will eventually feel sedated. Okay, the two main types of the anxiolytics as I have written above is barbiturates as well as benzodiazepine. So benzodiazepine, they increase the frequency of GABA channel opening. Okay, increase the frequency is benzo. As well as for the barbiturates, they increase the duration of the GABA channel opening. Okay, benzo increase frequency, barbiturates increase duration. Okay, so when we go to barbiturates overdose are directly responsible for accidental deaths, and in some countries it is okay. As for US, it is now used for the physician assisted suicide as well as lethal injection for criminals and all. Okay, as for the BZD, compared to barbiturates, BZD offers a cleaner profile and a lower toxicity in overdose, and it has been proven that it is helpful in sedating properties. That's why it is used in the treatment of seizure as well as relaxing a patient before the patient goes for a surgery. For in terms of short term, it is very useful, but it is when you are actually using it for a long term, okay, then you will actually have problems such as abuse as well as dependence. So as for the summary, okay, it's helpful to review the first rule of neurotransmission in the context of benzos because as they have the theme of the as they have some of the most clear-cut state of intoxication as well as withdrawal. And second of all, that you need to know is that all sedating and anti-anxiety effects get reverse drug withdrawal phase. So cases of rebound anxiety and insomnia are common in these days, leading to tolerance as well as addiction. Okay. Next, we are going to talk about benzos. So benzos are anxiolytics. Okay. So example of benzos are diazepam, flurazepam, lorazepam, metazepam, all the aze, okay, all the one that which actually got this word called as aze, shit, aze is the keyword. Okay, that is benzodiazepine. Okay, so half-life. So what you need to know when it comes to benzodiazepine is the half-life, because the difference is significant. I account for different indication of each benzos. For example, for short, okay, for short it is basically used in the panic attacks, status epilepticus, that is triazolam, oxazepam, midazolam. For medium, it is used in anxiety, insomnia, as well as panic disorders. And those are the clorazepam, alprazolam, clorazepam, as well as temazepam. Sorry, that is clonazepam. Okay, and the third one, long. That means that those which actually have a longer half-life. It is used in the chronic panic disorder as well as alcohol withdrawal, and those are the diazepam, so chlordiazepam. This is seriously difficult. Chlordiazepaxiol. Okay, so this mnemonic. So you have to remember this mnemonic. So short Tom, medium cat, long diver. So short TOM, medium CAAT. Okay, Ativan, or lorazepam is also known as Ativan, CAAT, and long TC. So short Tom, medium cat, long divers. Okay, so the mnemonic is Tom Cruise is shorter than his ex-wife Katie, and Katie, which is actually CAAT, and Katie CAAT is not giant, but she is medium in height. But what was long was the diverse proceedings. Okay, this is the easy way to remember. Next, I'm going to talk about buspirones. Okay, buspirones is another anti-anxiety agent, but it is not a type of benzo. Okay, we are moving away from benzo because there are other drugs for anxiety such as this buspirone. So usually this is just used for general anxiety disorder, and this drug, it is not involving GABA. In contrast to benzo, they do not cause a sedation. That's why when GABA is not involved, that's why it's not causing any sedation and no significant withdrawal effect. And they also have very little addictive potential. So the serotonin involvement may even make it as a better choice for this for those who are actually having this coexisting anxiety as well as depression. But why it's not used very often is because, like SSRI, therapeutic effects take several weeks to kick in, and probably side effects might show a bit, and then the patient might feel like, okay, this is just gonna bring harm to me. That's why I'm gonna like put this thing down, and I'm not gonna continue with this medication. That's why they won't take this medication. That's why they also don't use the medication often, like SSRI. So the mnemonic for this is Buspirone. Someone who's always anxious to miss the bus, take Buspirone. So in the next video, I'm going to talk about sedatives. So it's going to be a short video because we have come to the end of the video and my recording limit is going to reach. So that's why I'm going to take another video to explain those two sedatives. So meet you guys in the next video.